Hello, friends. I am Dr. Sumir Bashar, Interventional Pain Physician. Today, going to discuss about what is interventional pain medicine and what is the importance of it in today's practice. So, basically, I am an anesthesiologist and I have done fellowship in Indian Academy of Pain Medicine. And what is pain medicine and what is the requirement in today's practice? There are so many branches who are currently treating chronic pain condition like surgery, orthopedics, physiotherapist, neuromedicine, psychiatry, neurosurgery branches, etc. Then what is the branch like interventional pain physician or interventional pain medicine? This is a branch which will correctly diagnose the pain condition and will provide you the correct pain related treatment option and few treatment options which is only available with the interventional pain medicine. What are the pain options? What are the treatment options? So going to describe. First of all, you know that chronic pain, that is the pain condition, any pain condition more than 3 month duration. This type of condition, about 50 million adult person have daily onset of chronic pain. And as per CDC guideline, despite so many branches available in current scenario, but this type of condition is going to continue. So with this condition, right now pain medicine branch is evolving, and what we do, what is our aim, what is our goal, we are going to describe in subsequent. If we take a low back pain condition, this is the pain condition, this is most common pain condition after diabetes, most common disease. Have you seen any patient, have you seen any person, those person have not evidenced any chronic low back pain, acute or chronic, in their lifetime? No. Basically, this type of pain condition, everybody is suffering in their lifetime. Sometimes for few days, sometimes for few weeks, sometimes for few months. But what are this type of condition? Why this are condition is happen? Low back pain. Why? How will we get rid of this kind of pain condition? We will describe in subsequent part. And gradually we will know this, what is the branch, this acute or chronic interventional pain medicine. What we do, what is our goal, what is our aim. So low back pain condition, patients are not able to do work due to this low back pain, and the absence from their daily day-to-day schedule duty, they absent from their duty. This is common in India. Out of 1 lakh, 400 to 800 people, they are experiencing this type of condition. Also, you may experience low back pain in your daily life and your job, your activity, sometimes hamper with this condition. And this condition sometimes not only in India but also all over the world. You will see in this map that it is more prevalent in Western countries. And most common condition, most common cause we know as a slip disc, but disc is not slipped, and disc is not so much weak, that is our spine is not so much weak that this slip. This is actually disc herniation. Our disc cannot sometime cope up with day-to-day wear and tear. Sometimes disc bulge, disc hernia, and disc migrate upside downward disc migrate. Associated with these, there are thickened ligamentum flavum. All this condition leads to chronic or acute low back pain. Another most common cause after the disc bulge is facet joint arthropathy. This is the joint in our vertebra. This around there is 32 vertebra. This vertebra, there is every vertebra in between. There is the joint, facet joint. This will help us to move forward, backward, bending, sideward, laterally. This joint also hypertrophy, arthritis occurs. This also cause back pain. There are so many causes, and then comes to sacroiliac joint arthropathy, SI joint. This also cause our low back pain, sometimes underdiagnosed, misdiagnosed by our so-called neurosurgeon, neuromedicine doctors. So how we will diagnose, how we will treat this type of condition? Then sometimes some unfortunate surgery also done by the surgeon. Then this lead to failed back surgery. This is called failed back surgery syndrome. And your spine is going to be hell after the surgery, and you will be bedridden for the lifetime after one surgery. So before any surgery, you have to take care of your spine. You have to diagnose what is the condition, why this is going to happen. This is the reason we are here as a interventional pain medicine, as a hospital, and we are here to help you the correct diagnosis and the correct treatment option. Not only surgery, not only by physiotherapy, but also there are so many options available in our day-to-day pain, chronic pain, and our spine pain. So what we do? We do the correct diagnosis of your problem. By which means by your correct clinical diagnosis, and by clinically we can assess your pain condition. What type of problem? Is it lumbar radiculopathy, facet joint pain, hip pain, SI joint pain? We can diagnose your problem. Then on we will provide you correct treatment. This treatment option is include not only physiotherapy, pharmacology, psychology, but also interventional pain therapy. What is this? With the guidance of fluoroscope, that is the X-ray machine, ultrasound, with the guidance of all these newer advanced machine, we will introduce some needle in your spine, in your vertebra, at the correct site of your pain, at the site of your disease, and we will heal, remove your pain. Sometime for long, short time, sometime for long time. But these are the treatment. These are the correct treatment option. There are the varieties of treatment option available, like medium branch diagnostic block, medium branch radio frequency ablation, medial branch cooled radio frequency ablation, also epidural steroid injection. This is not oral steroid, so less risky, less complication, and more effective treatment option. And sometimes there is addition after surgery, after so many long duration of pain, percutaneous additional lysis is very important. If nothing is going to relieve your pain, then also we have some our treatment option available, but this treatment option is the last resort, and only we can provide you. This is the intrathecal pump and spinal cord stimulation option. And so you will gradually know why there is gradually interventional pain physician emerging to treat your chronic pain like low back pain. This is our one picture of our patient that undergone spine surgery, spine fixation surgery, but his pain condition was not removed or healed. Then he came to us and we treated him with medial branch diagnostic block followed by RF. This is the one needle at medial branch. And this is how we do medial branch cooled radiofrequency ablation. This is on probe at in gradually introduced at the site of pain or site, and we will treat your pain and will disease by newer advance like laser therapy. This is also cooled radio frequency ablation. They are very advanced. You have not even heard about this type of treatment option. This is the machine which will provide cooled radio frequency, and pulse radio frequency ablation therapy. These are the newer technology with which you will avoid your spine surgery. So few millimeter in gap in your spine after the surgery, you can avoid this with this newer technology, newer advance. And with this, there we will not inhibit you to do physiotherapy, pharmacology, yoga. We will also promote you to do all this therapy associated with this mind body exercise and activity modification. When you sit down, you should use your knee joint rather than your lower back to modify your posture. All this you will improve your disease and subsequently your pain. So with this, we are rightly interventional pain physician do uh, right now treatment. And our American Society of Pain Physician also this published some guidelines regarding how to do epidural, how to do facet joint, how to do some regenerative therapy to relieve your pain condition. And this year, 2020-21, is the global year about the back pain. According to International Society of Pain Society, ISP, there are few myths about our lower back pain. We generally thought it is a serious medical condition, but almost 90% condition is generally not life-threatening. Few condition when there is some red flag like your progressive progressive neuro deficit, motor deficit, sensory deficit, and bladder bile symptom, then only we suggest you to undergo investigation and subsequently surgery if required. Other than this, in lower back pain condition, surgery very rarely required. Mostly required your mental toughness and some activity modification. So if there is some lower back pain, it will get worse and your back stuff and you will end up wheelchair. No, this is the negative belief. And with this negative belief, sometimes we do surgery at early in our life and ended up in wheelchair. So you have to remove your negative belief and move forward and seek help to the advanced pain treatment option which are available with us, the interventional pain physician. We are not only interventional pain physician, we relieve the sports injury, palliative care in chronic cancer pain, everything. So pain related treatment only available with us. So sometimes myths are about the scan, MRI, CT scan will show the everything about the lower back pain, but generally this is not happen. What happens? Sometimes normal degeneration will show it is normal, but sometimes there are some facet arthropathy you have not seen in MRI. So correct clinical diagnosis and then correct treatment option should you lead to normal life after severe low back pain and severe morbidity with lower back pain. So if you have any lower back pain flare up, generally we take rest because we have damaged something. But rest sometimes is detrimental. It is weak in your muscles, lower back pain. And lower back pain generally aggravate by taking rest. Only rest is required some acute condition, not in chronic condition. You need some supervised exercise, activity modification, reduce your stress, and self-management. All this lead to your better goal achievement in your lower back pain. And the effective treatment not always injection, medication, surgery. Sometimes after surgery, the pain is not relieved. So what is important? Important is education. Education, how this happen, what is the cause, and you have to be physically, mentally fit, healthy, sleep happy, body weight should be reduced, and employment, you should not be unemployed. You should continue your work. We are here to take care of your back. Okay. If there is no specific back pain, sometimes we found that is the psychological. But psychological, only psychological things is not going to create all this pain. All pain are real. Psychological factor only aggravate the pain. Stress, anxiety, fear, all this aggravate. But we should actively do exercise, psychological intervention, and simultaneously seek help of the intervention physician to get rid of your back pain. And back pain that persists always lead to tissue damage? No, it is not. Issue is not the tissue, but sometimes our emotion, our coping skill, we cannot cope up with the back pain. Our socio-cultural belief, all this lead to our fear, our negative mindset, and our poor coping skill. All this lead to our continuous pain, chronic pain in the back, which is most common, most frequent. So we have to avoid, we have to get rid of this fear, negative belief. And back is the delicate structure or weak structure, we think, but it is not. It is a very strong and robust structure. Sometimes very strong, this cannot sleep or move. Our back pain will resolve within week, within month. If we do active intervention, active psychological treatment, active physiotherapy, pharmacology, and if it is not resolved, we are here as an interventional pain physician to get rid of all your back related pain. So what is interventional pain physician? What is interventional pain management? According to American Society of Interventional Pain Physician, interventional pain management is discipline of medicine that devoted to diagnosis and treatment of pain-related disorders. And it is not unimodal, unidirectional. This is a multimodal approach, and we will take care of everything with the help of physiotherapy and psychology. And this is the month, September is the pain awareness month, so that we are creating awareness among the patient who are suffering the one of the most common pain condition. This is the lower back pain. And if you have any problem associated with this, associated with pain, either you are young or middle age or old age, you may have so many problems. You should take help of the pain physician, interventional pain physician, to get rid of your problem. So if any problem, feel free to call us, call me. Thank you. Bye bye. We'll take care of another problem in next video. Thank you. Good night.